Good morning, everyone. I'm Kim Mccleary, President and CEO of the Los Angeles World Affairs Council and Town Hall. Thank you all for joining us. And a big welcome to our new viewers and members in California and across the United States. Thank you so much for your ongoing support of the Council Town Hall through your contributions, by becoming members, and by renewing your memberships. As one of our members recently shared with me, the need for our informed, nonpartisan discussions is more critical than ever before. These live streams will continue to be a key part of our programming going forward. And when we can do so safely, we will be bringing back our popular in-person programs. Our in-person programs were a key part of our revenues. And now that we are producing the live streams for free as a public service, we need you more than ever. Please visit our website at lawac.org to see how you can support us so that we can continue to provide you with quality interactive programming like today's. I am very pleased to introduce today's program focusing on what's ahead from a health perspective as we go back to work and begin opening our communities. We have a terrific panel for you. Today's panel includes Dr. Jennifer Cates, Director of Global Health and HIV Policy at the Kaiser Family Foundation, Dr. Joshua Michaud, Associate Director for Global Health Policy at the Kaiser Family Foundation, and our moderator, Michelle Levander, Founding Director at USC Center for Health Journalism. For those of you who are joining us online, we will be taking questions in about 20 minutes. You'll see a panel on the right-hand side of your screen where you can type in your questions. Jessica DeGanzik, our Vice President of Events, will be managing your questions during the Q&A portion of today's program. We'll try to get to as many of your questions as possible. Michelle, it's time for me to turn it over to you. Thank you so very much for moderating today.
Thank you so much. It's really an honor to be here. Thank you for inviting me and for all of us to participate in this really important conversation. I'm Michelle Levander. I'm Director of the Center for Health Journalism at the University of Southern California. And our center helps professional journalists produce impactful reporting on community health and well-being. These days, we're also hosting weekly covering coronavirus webinars for journalists, policy leaders, and others interested in this evolving story. I want to turn today to something that goes beyond COVID and the reopening of the economies of California and other states as these restrictions are eased. The challenge, which involves balancing public health and risks with efforts to restore economic activity, has been overtaken in the news and in all of our thoughts and actions by a harrowing example of brutality, the police killing of George Floyd. The process that have followed have led all of us to rethink where we are as a country and a community and where we need to be. Many are saying that Black Americans are facing two colliding public health crises, two pandemics, the disproportionate toll of COVID-19 and the pandemic of systemic violence and racism by authorities against Black Americans. As both of you are public health experts, I'd like to ask you to talk about one of these twin pandemics, the disproportionate toll of COVID-19 on Black Americans and low-income families. Jen, what do we know about the underlying reasons for that, and what steps could help us to reduce those disparities? Jen, you might want to unmute because we're not hearing you.
Sorry. Hi, everyone. Thanks so much for having me on this webinar and being back here to talk about this important topic. Before I go specifically to focus on the impacts of COVID-19 on Black Americans, I just want to say, what, as a public health professional, watching what's happening in the US right now and seeing that we're at a real inflection point, hopefully, with more and more people realizing the very deep impact that racism has on the health of Black Americans and on really everybody. It's just unfortunate that this is happening in the midst of this pandemic. And so this is a unique time in history for many, many reasons. Going to COVID and what we know about the impact there. So in general, there are two things going on that I think people should be aware of. One is no one is uniquely more susceptible to becoming infected with this virus than anybody else. Just like, as somebody just out and about or doing the same things. The issue is how likely are you to come into contact with this virus? And then once you are infected, what may happen to you? And what we know in the US is because of living conditions, because of entrenched patterns around inequities, racial inequities and others, income disparities, people of color tend to be, on average, more likely to come into contact with exposure because of the jobs they have, because of tighter housing conditions. This is not for everybody, but on average, looking across the population. So the rates of becoming infected are a little higher. But really where the disparity has been seen is what happens when you're infected. This is a disease that most people do fine with and recover, or maybe never have symptoms, but a subset of people get very, very sick and die. And this is obviously why we're in this global pandemic. What we see in virtually every place throughout the United States, the share of people who are getting sick, hospitalized, and dying is so much higher among people of color, Black Americans in particular. And that is a reflection of poor access to healthcare, economic disparities, safety issues, housing challenges, education challenges. So the underlying set of factors that are also what we're seeing now as the challenges that we're all grappling with as a country. How do we address those? I think the unfortunate piece of this is that these are so entrenched and not unique to COVID-19 that addressing them should be our national project right now, and hopefully will be. So, but I think that the first thing is that public health officials and politicians need to recognize this disproportionate impact. If they don't recognize it, it's going to make it worse.
Thank you. And, it's not top of mind for the protesters who are out on the streets right now, but public health officials are calling these protests a potential super spreading event. And I'm wondering if, Josh, you could address whether this could worsen disparities and what else we know about these sorts of risks.
Thanks, and I'd also like to say thank you for the organizers to having me participate in this, and it's a pleasure to be back here. So in regard to your question, yes, from a public health perspective, given what we know about this virus and how it transmits, there is a concern that having people crowd together and vocalizing and chanting and singing, and sometimes protecting themselves with masks, but not entirely. And then also the police actions that are being taken to control these protests or in response to the protests themselves can exacerbate situations, things like use of tear gas or other chemical irritants, which can, irritate the same types of body parts which are involved in transmission. You put these factors together, crowding and the police actions, and you do worry about the public health impact. And it may be that we will see increases in the coming weeks. But I'd also say that this concern takes place in the context of a country that is also opening up in terms of people returning to work and returning to public spaces in general. And so there's been movement towards relaxing the social distancing guidelines that have been in place for so long, and that is happening concurrently with these protests. So it will be hard in many cases, I think, to determine the exact cause for any increase in case numbers that we see later on. But these two things working together make for a combination which is troubling from a public health perspective. Even though, as a citizen, I can understand the reasons for why these protests are taking place and why they're so important. One other thing about the protests is that not only the protests themselves are occurring, and one positive thing is that they happen for the most part outside, And we know that outside transmission is less likely than indoor transmission for this virus. But we've seen large numbers of people who are put in jail, arrested for these activities. And when you have crowded conditions in jail, and we know that jails have been a place where we've seen a lot of transmission, that's another potential vector for this virus going forward. And just to finally say that, the protests have interrupted some public health interventions. For example, contact tracing has been harder under certain conditions. Testing, hasn't been as widely available, although there are recommendations that all protesters get tested if that's possible because of the potential exposure risk. So public health people are working towards ameliorating the effects of these protests and on reopening on disease transmission going forward, but it is something to be concerned about.
Thank you, Josh, for that really thorough answer. I'm going to switch gears a little bit to talk about a concerning set of numbers. Just this week, daily cases of COVID-19 hit a new high across the state of California, topping 3,000 new daily confirmed cases for the second time in a week and contributing to the 115,000 cases and more than 4,300 deaths that the state has reported since the pandemic began. And Johns Hopkins University, which is tracking cases, describes California as one of 20 states that have seen an uptick in cases in the past 5 days. So Jen, as we look at these numbers, should California continue to reopen, and what are the best practices that people and policymakers should be following?
Right, very good question. Those of us who are paying close attention to these numbers have been talking about California as one of the states where there are some disturbing trends. So when you start to see a rise in cases, the first thing that you want to do is assess, is that because of increased testing? Because sometimes more testing, when you test more people, you're able to identify more cases. That's not what appears to be happening in general as the main driver or as the only driver in the state. So you have to kind of look below that and say, are there certain pockets of the state that are really having the increases? And unfortunately, it does appear to be the LA County area. So I think this just begs the larger question of what is actually happening. Are the measures that are still in place being followed, or are the measures are they too relaxed? And is there an issue of that the policymakers and public health practitioners really need to be paying attention to? Are hospitalizations going up? And it looks like they might be in a couple of places. Are deaths going up? Because those measures are very independent of testing. They really are a sign of a problem. So I think this is exactly the delicate balance that we are in different places around the country. Has relaxation happened too much? Are there ways to move forward, or does the state or certain areas have to pull back? I don't think anyone wants to have to pull back, but it is a cause for concern for sure.
And as we think about the decisions we make as individuals and policymaker decisions, it does seem like we're getting different and sometimes even competing messages from the president and health leaders like Dr. Anthony Fauci on a range of questions regarding COVID-19. So Jen, how should we be thinking about such fundamental questions as how much to test and the value of testing in light of that conflicting information?
Right. So you're raising a very important challenge, and it's one that's not unique to COVID-19, but it's certainly playing out on the national stage with COVID-19, which is the battle that always seems to happen between public health and science and politics. This has played out in many other issues. My background is in HIV, and in the context of the history of addressing HIV, there were many times when science and politics clashed. And I think what we're seeing is that happening, where there's the science where we know what works. Scientists should be listened to. And the other thing is what good public health and a good public health scientist will say is when they don't know if something's working. And I think Dr. Fauci is a great example of that. He's pretty clear about what we know and what we don't know. That's different than politicians not always conveying the same information. So I think and politicians have different considerations, right? They have to consider a whole range of other factors. But in this case, by what we would advise is pay attention to the public health experts and listen to their words, listen to what they say they know, what they don't know. It's just as important because there's a lot we're still learning. This is a novel virus after all. But it's a tough one for the average person out there who wants to read the news and try to understand what's happening to make sense of all of this. On the testing question, just to get to that specifically, it's been shown again and again throughout, in many countries, including the US, we need more testing. This is a virus because we don't have a cure, we don't have a vaccine, and a share of people get very sick and many die. We need to understand the spread. And the only way you can understand the spread is if you're adequately testing, and I would add, and then having contact tracing at a sufficient level to be able to follow up and hopefully isolate cases. If you don't have those things, we're still going to be in the same situation that we've been in. The whole idea of social distancing and physical distancing and closing down parts of our society was to allow for that capacity to expand and save a little bit the healthcare pressure. So save the hospitals for, not overtake the hospitals with very sick people and lots of death, which has happened in other countries and actually was happening in New York City, and use that time to increase testing and contact tracing. Unfortunately, that hasn't happened as much as it should. But by any measure that we've looked at, that every health expert has looked at, we need more testing.
Thank you. And as we think about all this, the Centers for Disease Control is really supposed to be, navigating and helping us navigate through these waters, and yet they've come under widespread criticism for failing to act decisively early and to communicate clearly. Josh, do you think there is truth to these assessments? And what does the country need from the CDC at this moment in time? Has it lost the public's trust?
Yeah, well, first I'd say that there's no question that the CDC has been and remains an absolute jewel of an institution for the United States and for the world. It's the home to expertise that exists nowhere else, and it will remain important to this public health response and future public health responses, both here in the United States and globally. With that said, I think there is some room, or you can understand where some of the criticism is coming from. And some of this is because of actions or errors made by the CDC itself, and some of this is because of pressures or barriers that come from outside the institution. So going back to the testing question, I think it's clear that one of the unforced errors that the CDC has committed is early on not being able to produce an effective test for this virus, which essentially blinded many states early on in their ability to understand where the virus was and for people to be diagnosed with this virus. Other countries had access much earlier than the United States to widespread testing, and there wasn't much of a good excuse for why the United States couldn't have widespread testing early on as well. And CDC had a large role to play in that problem. But another aspect of this that you referenced was communication, and the CDC has been, it was communicating early on about the risks of this pandemic, but of course the CDC's messages got subsumed under the White House messages, and the face of the public communication around the pandemic moved from CDC to the White House Coronavirus Task Force, and sometimes the president himself, which is not something that you could lay at the feet of the CDC as being their problem. I'm sure they wanted to be out there messaging what are the best public health messages at the moment. And as Jen talked about, there can be some difficulties when you have politicians making the messaging or basing their messages on political concerns instead of CDC might be out there basing it on public health concerns. So, there are other concerns about the CDC, and not always their fault again. They have antiquated systems. So one thing you'd want from the CDC is to be the source of information about where this virus is, what are the trends, who's affected, the best epidemiology about COVID-19. And they have not really been that resource. And it's been very, very difficult to get national level information. And people have turned mostly to other sources other than the CDC. Although they've made progress in that front, there's still a long way to go. And just this week, there's been congressional hearings about the CDC's response, and they've been criticized for not having race and ethnicity data, or pushing to have that information about cases. And they've made the promise to include that now, which is, of course, has been important all along, but the absence of which has been magnified because of the current situation with the protests, et cetera. So yeah, just long story short, I think that there are reasons to criticize the CDC, but they remain such a vital institution going forward, and we should do everything we can to support their work.
Thank you. And Josh, before the before the protests broke out, data was suggesting that people were already starting to relax their guard when it came to all these protective measures and shelter in place. We've seen data published showing tracking of mobile phones, that people are just out there more. And I wonder, are people getting ahead of where they should be and where we need to be from a public health standpoint? And are we possibly setting ourselves up for a resurgence of COVID-19 as a result?
Yeah, this is a concern, of course, and there has to be a balance between people resuming their normal lives and economies being restarted after these lockdowns and public safety from further transmission. I'd say that given what we know about the way the virus transmits, we can start to look at different activities as being of different levels of risk, and perhaps we can discuss more about that later. But we know that there are certain activities which are fairly low risk, and others which would be higher risk. And for the most part, I think states and cities and people are mostly avoiding those very high risk situations, whereas we're seeing more movement towards the lower risk. And there's been a slow and steady, I wouldn't say that there's been a dramatic change, despite some very notable instances of people crowding together in certain locations. But for the most part, I think people take this seriously and aren't sort of relaxing too much and avoiding the sort of situations which would be at high risk for transmission. And those would be what have been come to known as the 3 C's, which is crowding, closed spaces, and close contact. So avoiding those types of situations has been at the heart of this sort of gradual reopening. And I think there's been mostly general public adherence to this. Another aspect of this would be mask wearing, which is of course recommended by the CDC as a preventive measure, especially when you're outside or in closed spaces or close to others. And while there's been some discussion about whether people want to use masks, where they think it's not a good idea, for the most part, in many places, more people are wearing masks, which is certainly a good thing for prevention. We'll see how, I think that there's been a yearning, of course, after a period of lockdown for people to get their lives back to normal. But I'm cautiously optimistic about not going too fast, too soon, but that doesn't apply everywhere. There's certain places where you do worry about this. And of course, the protests and the things we were talking about earlier can create the conditions which exacerbate transmission going forward.
So I'm going to ask both of you ask Jennifer actually one last question, and then I'm hoping that all of you can share your questions. Just a reminder that Jessica will be fielding those, and that you should just put them in the question field of the GoToWebinar control panel. So Jennifer, I just want to follow up on what Josh was saying and bring this down to a really practical level. We've been talking a lot about policy, but how should our audience here think about the best ways to calibrate risks in their own lives? We all know that there are these rules. You should not gather above certain numbers, but do you see your grandparents? Do you wash packages? Do you go to church or see your neighbors? How would you recommend people make decisions about some of those things that they think about every day?
Yes, this is the question that all of us are grappling with, these questions and these decisions. And one of the things that has come out of largely the HIV movement as well, but others too, is this concept of harm reduction. That there are times when you have to make decisions, and most times you're making decisions with imperfect information. You have to make the best decisions you can to minimize the harm as best as possible, to reduce the harm. You can't always eliminate it completely, but you can reduce it. We're in a situation where, as I said earlier, we have this novel virus. We're still learning a lot about it. We're still, back in March, it wasn't so clear what was the most risky activity for spreading COVID-19. Many people were quite worried about packages. Well, now we know that while yes, there is potentially some risk from surfaces, it's not as huge a risk as we had worried, and nor is it as huge a risk as other activities. All that is to say is, from an individual's perspective or a family's perspective or even an extended family's perspective, I think it's important that people start to try to assess, because we all have to move forward in some fashion. What are the things that are most risky? Where are places where I really need to take lots of precautions? And are there things I can start to do safely to expand my circle a little bit? Does that mean, for example, seeing friends down the street, keeping your 6 feet distance, having your masks on, but really getting to spend more time with them, or potentially pairing up with another family or another person that you then keep your social distancing going on with, but you allow yourself to have some more people in your circle. That could be grandparents. I mean, I would say there's a special concern that we have to think about, since of those people who become infected, those who get sick tend to be older individuals. So there's a lot of concern of protecting grandparents. That's the big issue here. So every person and family and group is going to have to make those decisions. But I do think there's a hierarchy of risk that is being better articulated, better developed. And there's been materials written about this by some great epidemiologists, and ways that we can start to move forward and be more confident that we will be okay in doing some of these baby steps.
Yeah, well, thank you so much. I want to just invite Jessica to come and help us field questions from all of you at this point.
Great, thank you so much. We're getting a lot of questions. Let's see. There are voices to reduce budgets for law enforcers. What will happen to the social peace and order? What will happen to the safety to the general public? And Josh, I'll direct this one to you.
What will happen to peace if we reduce budgets for police departments, basically?
I think that's what they're asking.
It's not my area of expertise, I would say, and only from an outsider, non-expert perspective, I would say that from what I've seen, many police departments have become highly militarized and have had a lot of support from the federal level in particular, and perhaps some reimagining of what the police department's role and approach should be in the wake of the protests and what's been brought to light now is worthwhile. Whether or not cutting the budgets has something to do with that, I'm not in a position to say. But I think it's clear that budgets do show priorities, and if what we've seen is highly supported defense and military and security forces, while we've had our public health, local health departments and other institutions in public health have been fairly underfunded. And given the crisis we're facing with this coronavirus pandemic, the implications of not funding public health, have come to the fore, I think. So, imagining the proper balance of what is actual public threats and the best ways to address them, this is maybe a moment to look at those things. So I know I didn't directly answer the question, but I don't know enough about the budget to say that specifically, so thanks.
That's a good start, thank you. Jen, you kind of touched on this on your last question, but this questioner asks, no one seems to want to talk about depression, suicides, substance abuse, et cetera, that come with the lockdown. Can you address this issue?
This is a really serious issue. I do think that more and more people in the public health and community at large are talking about this. We've actually done polling on a pretty regular basis of the American public and find a huge share, many people are saying that they're suffering mental health consequences or exacerbated. And, those who already had mental health or substance use issues, those are exacerbated, others are feeling them. So I think that that is a public health crisis too. And so part of the the decision making around easing up on the restrictions is recognizing that the restrictions were never meant to be the end result. The restrictions were put in place to allow us to buy some time, really. And everyone, I think, recognizes that they've had very challenging effects, not just the economic effects, but as the questioner said, I mean, the effects on our mental health and our social health and the strain. So that always has to be weighed against how do we move forward. But I do agree. There's never enough attention to mental health and substance use. There's not enough funding for those things, and this pandemic is unfortunately exacerbating those. And I've seen some folks write about how there's after these kinds of situations there's PTSD. So after we sort of are in a new phase and more communities are open or back to normal in some sense, people will still feel the effects of this, and we just have to be very wary of that.
Thank you. Josh, what is the proper relationship between the U.S. and the World Health Organization going forward?
Yeah, that's a complicated question, but just as I was talking about the CDC being a vital institution, the World Health Organization is an institution that globally can't be replaced. I mean, the role that they play in coordinating, responses to epidemics and pandemics and setting up the conditions where countries all over the world can be prepared for such health crises. And that's just one of the things that they do. I mean, that role can't be really replicated, and they have the unparalleled legitimacy to address global health concerns. That said, it seems like it would be a no-brainer that the United States would want to be part of that institution and part of the discussions that go along with trying to address truly global threats. And withdrawing from the World Health Organization, as has been suggested, there's a lot of discussion about what that actually means, whether it can happen, under what conditions it could happen. We still don't have a whole lot of clarity about how that would progress, if it is going to progress. But it would certainly seem to be detrimental, both from a global health perspective, because the U.S., of course, is one of the important supporters of the World Health Organization, not just financially, but technically and in terms of expertise. But it just would harm the U.S.'s national interest, because we are tied to the world when it comes to something like a pandemic. As long as the threat remains out there, it's a threat for every country, including the U.S. And the solutions, including technical solutions, and the World Health Organization is leading an effort to do research and development related to vaccines and treatments, and the U.S. has not been participating in that. And one would think that you would get better outcomes through active participation and collaboration. So yes, I think that there's a lot of reasons to think that the U.S. would be better off with an active and robust relationship with the World Health Organization, and that by reducing that relationship in whatever way or fashion would be detrimental to the US's interests.
Thank you so much. Jen, when do you think we will see if the protests have generated a super spreading? Also noting that the majority of protesters seem to be under 30, so they may not get too ill or seek medical care.
Right, this is a very good question. Given the incubation period of this virus, if there are going to be increased transmissions, we would likely see them, I would say, in the next couple of weeks. We'd start to see patterns potentially. And then the question is how, what if people are able to be tested, and the recommendation is that people should go get tested who've been involved in protests, if they are positive, to basically find their contacts and do the public health measures that have to happen. But really, I'd say the next 2 weeks are pretty critical, but it could extend beyond that. If people are infected and don't know it and don't show any symptoms, but then transmit further on. So I'd say the next 2 weeks are where we might start to see it, but to look out throughout the summer would be sort of the time horizon. And it's not just the people protesting, as Josh mentioned, the law enforcement that's involved too is, they're coming from different states. I read something today that I live in Washington, D.C. There have been law enforcement brought in from 10 other states to Washington, D.C. for this. And that's at a time when, we're not supposed to be traveling around the country. So there are risks here for sure.
And I'd only add that, in addition to, it is true that, those under 30 are less likely to experience severe disease, but of course they carry that and can transmit to household members or others who are at risk. So that's at the core of the concern, that you're sparking new transmission chains, and people who would otherwise not have been infected and have severe disease would be infected and have severe disease. So that's the worry.
Thank you so much. I'm not sure which of you would know this information, but do you have any stats on outdoor transmission that you can share with us, and also the impact of sunlight and warmer temperatures that might make this less spreadable going forward into the summer?
Yeah, so it's become very clear, and I think that there are a number of studies now which support the notion that outdoor transmission is quite rare. And the reason why we can say that is because in countries where they've had robust contact tracing efforts, they've been able to understand exactly where are the locations where transmission has occurred. And so there was a study reviewing a bunch of different contact tracing studies, over 150, I can't remember the exact number, but putting all this information together, the highest risk locations for a transmission have been indoors, and that includes households, that includes workplaces, that includes places, where public gather indoors in churches or in public events or things like that. And only in very rare incidences had there been recorded transmission in an outdoor setting. So one study, for example, said that the risk of outdoor transmission was 1/19 the risk in indoor transmission, based upon the data that they looked at. So if it's not that specific number, then it's definitely much lower in an outdoor situation. And it has, I think, a lot of things that are driving that. And one is that, of course, outdoors, you may be a more socially distant, easier than in an indoor situation. Having ventilation with the outdoor, it reduces the chance of transmission. And we do know that sunlight can, inactivate this virus. So put all those things together, and you have much less. And not to mention that you're less likely to spend an exorbitant amount of time in close contact with someone outdoors as compared to indoors. You put all those things together, and you have conditions for much lower levels of transmission outdoors.
Thank you so much. Jen, in your opinion, what does preparedness look like for later this year when we will see cold and flu season return? and a possible second wave of COVID-19?
Yeah, so there are a lot of things that encompass preparedness for this, and these need to happen at the national level, at the state level, at the local level. First of all communities need to have enough capacity to robustly test and trace and isolate cases if there are second waves or further into the fall and winter. So that has to be done. It's counterintuitive, but that's prevention. You have to do things now to prevent later. So that capacity has to be there. The ability of the healthcare system, hospitals, ICU beds, et cetera, and protective gear, all the things that people are reading about as problematic. Now's the time to make sure that if they are needed, they are not, there's a sufficient ability to respond. If those things aren't in place, we could be in a very serious situation. If those things are in place, there are examples from different countries where they have opened up and they've had events where, incidents where somebody was positive and started to spread to others, and they were able to basically break the chain of transmission and not recreate the scenario that they had prior. So that's the goal here. Other things that everyone's still grappling with, though, is what does that mean for returning to your office? What does that mean for returning to school? Do you do that? What kind of precautions should you take to do those activities, knowing that there may be, there's a chance and likely chance that there will be a resurgence with flu season, that they will also see this. So many universities, colleges and universities, for example, are either going to do remote learning in the fall or some combination of in-person and remote, and then have all the students go back home after Thanksgiving and not come when it's the flu season at its height. So we don't have all the answers, but at a very basic level, the things that everyone has read about were problematic and that we were lacking. Those are the things that really, really need to be in place to be prepared.
Yeah, that was very comprehensive. The only thing I would add to that is that you mentioned flu, and one thing that can be done is actually getting a flu shot. So if everyone is protected against the flu, that's one less stress on the health system that may become, stressed if we have a large wave in the fall. So getting a flu shot can actually prevent worse outcomes from COVID as well.
Meaning that if people don't get sick from the flu,
right,
they're not straining the system, and that's what we want. Yeah,
exactly.
Yeah. Both of you kind of mentioned this a little bit, but right now our media has kind of taken their eye off the ball about communicating these public health concerns. We're not hearing the encouragement to wash our hands. They're not talking about asymptomatic spread, and still talking about masks a little bit, but you're seeing that not being pushed as much. So how would you like to see our media and those that are in the healthcare industry that have influence, and of course even our politicians, start talking about this again?
Well, I mean, the media I think media have done an excellent job in helping the public understand what is going on with this outbreak in many ways. Very quickly, investigative journalism has uncovered many incredible things, and that's a story unto itself. Unfortunately, with the country just gripped right now by what's happening, all of our attention is focused primarily on what's on the challenges right now in the country around racism and police violence, as they probably should be. And so it's really hard to hold both things at the same time. There are media who are doing it, either connecting the two or continuing to push out the information on both. But one thing that is a bit of a concern to me is that even before this very bad situation that we're in with the murder of George Floyd by the police and other police violence, it seemed as if the White House and the president had already started to shift away from a focus on COVID-19. That there was a sense that, okay, we've done that, we have to move on. And that's that. So I think a little bit of that came from the top and has permeated down a little. So it's not to the media per se, but to the public. And we need those messages. Those messages are really important. Those messages will save lives. So I don't know what the answer is, but hopefully, many more reporters and others will continue to do these stories, and public health officials in all communities will continue to put out the information. I live in Washington, D.C., as I mentioned. We are having protests just a few blocks from where I'm sitting right now. But at the same time, the mayor is giving a daily briefing on COVID and just announced new testing locations throughout the city. So there are public officials who are doing both and keeping that up.
Yeah,
Thank you,
and
so.
I'd only add that the fact that we're having around 1,000 deaths a day still it means that this is something that needs to be focused on. But it's understandable if there's only so much attention that can be given by the media or by individuals in the public, and that may change going forward. If we see a spike in cases, of course, you'll see an increase in media attention towards this. And if we see a big rise in the fall, of course, there will be added attention to this. So in some senses, there is, reason to believe that more attention will be paid later on. But as Jen kind of insinuated, there is a concern that in some people's mind, at least, this is now over, or this is now something we don't need to think about, or that the worst is behind us, when that might not necessarily be the case. So there is some concern about that, and the media would have some role to play, as well as policymakers, of course, in making sure that message is out there that this is something that we need to keep in mind going forward and keep track of as we go through the summer and into the fall.
Thank you so much. Do you know if there's been improvements on the antibody testing, and then also if people can catch this virus more than once?
So the antibody tests are those tests which detect whether an individual has been exposed to the virus in the past. So if you are positive in an antibody test and truly positive, that means you were infected before and that you have developed antibodies to the virus. We still don't know, of course, what that means in terms of immunity. It likely means that that person might have some immunity to the virus, especially in the short term. So if you've gotten the virus and recovered, then you're likely, at least in the short-term basis, immune from reinfection. But we don't know how long that will last. And the other thing that is concerning about the antibody tests, of course, is that we have a wide range of quality when it comes to these tests. So right now, there are on the order of, I don't know, Jen, like what, 100 different tests out there?
That's a lot.
And they vary incredibly in terms of their ability to detect the antibodies to the virus. And that situation has come about because there was a push to get these tests out there because they felt they were important, and they are important, but that has meant that the market has been flooded with sometimes substandard tests. So what happens with a substandard test is that you might have someone who's tested, they might be positive, and that would seem to show that they are immune, but when in fact the test was incorrect and you had a false positive and that person was not, did not have antibody. So in that situation, the person might walk away thinking that I'm protected when in fact they're not. So that false negative problem is a real issue, and the more sensitive tests are better at avoiding that problem, but it is a real problem with all the tests. So where that leaves us is that it's very difficult to recommend that individuals take the results of an antibody test, whatever test, and think I am immune or I am not immune, because that's not what the tests can show. And you might not have a perfect test. And so that's the concern for public health officials. They are very helpful for public health officials to determine sort of how prevalent the infection has been in certain communities. And so we've seen antibody, seroprevalence surveys, as they're called, of whole populations. We've seen some in LA County, in other places in California, and New York City, and other countries as well. It gives us a sense of how widespread the infection has been. It's been very, very helpful to get a sense of, how vulnerable communities remain to this virus. But from an individual diagnostic perspective, it is difficult. Although, we know that there are workplaces and people who are pushing towards getting these tests as a way to show that they can go out in public again, and that would be something to be concerned about, I think.
Thank you. For both of you, would you take non-essential flights now or even in July? Would you advise elementary schools in Los Angeles to open for on-campus education this September?
You want to take that, Jen?
Would I take non-essential flights in June and July? No, I wouldn't. Do I think some people could? Yeah, but the whole point of it's a non-essential flight, let's wait and see where we are when there's more time that's passed. Obviously, there are precautions that people could take. Some people are, but again, if it's a non-essential flight, I'm not going to do that. And I don't think that's a wise choice. It also raises the question of if you're just moving about, you're also having to think about who you're going to see, and do you need to have first made sure that on both ends there was quarantine for 2 weeks and all of those things. So there's a lot of other considerations, but I guess in general, I think we're still, let's not remember July is just around the, I forget that July is around the corner. So that's one. On the schools, I have a little kid that's been out of school. I want schools to open on some level, but I don't think we have enough. I think the guidelines are still being developed. There's been some early good signs from countries that have open schools, and many of the countries in Europe have open schools and have not seen resurgence and big challenges. So that's a good, hopeful sign. But those countries have also taken measures, and they're not just going back to normal. So my assumption is that that's what we'll see in the United States. We'll see school districts working towards some kind of accommodation for the situation we're in. As a parent, I hope we can figure that out for everyone's sanity.
Well, Josh, maybe I'll pivot the next question then a little bit, just as a follow-up to that. This one asks, as a spouse or family member of a frontline worker, my spouse is a physician, how should we behave according to guidelines as things are opened up? What precautions should we take? She says that she sees herself as a potential carrier, so she avoids all other other than essential interactions. So I guess what are you advising frontline workers? And also, I guess just personally, how are they doing? Because they probably thought there was a light at the end of the tunnel, cases were going down, and now they're worried again about this uptick.
Right. Well, a frontline health worker is going to be at risk of exposure, with or without reopening, during this entire. I assume that this health worker works in a situation where they see COVID patients or may be exposed to COVID at the workplace because the COVID patients are being seen there. If that's the case, then I don't know if that risk would dramatically change because of reopening or not. It may be that in certain locations, cases have gone down so much that now they're almost nobody's being seen. That might be true, and you might see a spike that would increase the number of cases being seen in certain locations. So I suppose that there is a potential for that to increase, but with proper precautions in place, I think that health workers can protect themselves, and that they have been fairly good at protecting themselves up until now, although that hasn't always been the case, and tragically some health workers have got infected and died from this virus. So it does leave those in households at higher risk potentially of becoming infected, and I don't think there's an easy answer here. I think that there is reason to perhaps take additional precautions if there is the health worker is being exposed constantly, and I know that there are stories of health workers that have been sort of isolating themselves from other family members. I don't know how sustainable that is or how applicable it is to this particular individual situation, but it's not necessary, but it's a precaution that I know some have taken. So it's really a matter of individual decisions here, and I don't know if there's one strong, definite answer here. So I know I didn't directly answer the question, but it's a difficult one and requires some balancing of risks and the benefits of being together in the household.
Thank you. This will be my final question, but Jen, you mentioned some great resources from epidemiologists. Sorry, I hope I said that properly. Would those be, can you tell us where those resources are, or is that something that you could maybe share with me that I could send to attendees afterwards?
Sure, we'd be happy to send a set of resources that are out there that we think are good. You mentioned the media earlier. Some of the resources that are out there have been produced by media themselves who are school, either have epi backgrounds or understand data really well, or have worked with epidemiologists to develop really helpful materials. So some of the ones I'm thinking of have been done in that fashion. But sure, we can certainly send some. We have some on our website, but I'd say our audience tends to be more policymakers and media themselves, and less the public. But yeah, we'd be happy to send those along.
Great.
Sure.
Will you share that website with us really quickly, and then I'll turn it back over to Michelle?
Yeah. So our website is www.kff.org. Please visit.
Thank you so much. Thank you, Michelle. I'll turn it back over to you.
Yeah, I just wanted to thank our two really wonderful panelists, Dr. Jen Cates and Joshua Michaud, for this really robust and valuable discussion. I also want to thank the audience for the really smart questions, and most of all, I want to thank the LA World Affairs Council for hosting this conversation.
Thank you.
Thanks very much. Good to be here.
Well, Michelle and Jen and Joshua, this was such a terrific conversation, as Michelle said, and we were so glad to have you all back. It's so timely, and this information is so valued. So thank you all so very much. Next week on June 9th, we have the ambassador to Germany, Dr. Emily Haber, in conversation with Ambassador John Emerson, chairman of the American Council on Germany. And of course, next Thursday, Politics in the Time of Coronavirus with politics professor Dan Schnur. On your control panel, you'll see a tab that says handout. You can click on that and see a whole listing of all of our upcoming programs. And please visit our website at lawac.org to see how you can become a member, register for programs, or make a donation. Please stay safe, stay informed, and hope to see you soon.